Getting older means a lot of changes for the body. As early as our mid-20s, our metabolisms begin to slow, and unwanted fat slowly develops around the body. Even those who diet and exercise aren't immune to stubborn pockets of fat. Depending on one's genetics and propensity for fat storage, you may lead a healthy, active lifestyle and still succumb to unsightly bulges in embarrassing areas. During adolescence, and especially around the time of puberty, many women begin to develop small pockets of fat above their pubic bone in the area called the mons pubis, commonly referred to as the pubic mound. This rounded deposit of fatty tissue forms naturally over the pubic bones and varies in size depending on the level of hormones and body fat one has. Generally, once the pubic hair grows, this area is covered and becomes less noticeable, but for some women the pubic mound can enlarge to a size that is embarrassing, even making it difficult to wear some clothes comfortably. This procedure involves twilight sedation or a general anesthetic. The surgeon will make small incisions, through which a thin cannula will be used to remove the unwanted fatty tissue. The recovery process for a mons pubis reduction is quick, and patients can often return to work the next day. It is expected that you may experience some swelling and bruising or a slight discoloration of the region and its surrounds. In most cases, you will see a return to normal appearance within 2 to 6 weeks. There are several steps you'll need to take in preparation for your surgery. Before surgery, arrange for someone to drive you to and from your surgery, and for someone to be with you for at least 24 hours after your surgery. Avoid drinking alcohol, starting 2 days before surgery. Stop taking medication that increases your risk of bleeding such as aspirin, nonsteroidal anti-inflammatory, NSAID, drugs and all herbal remedies 10 days before surgery, or according to your doctor's instructions. Avoid smoking 2 weeks before and after surgery. Usually, pubic area liposuction is performed at an outpatient same-day surgery center using sedation and local anesthesia. An overnight hospital stay might be required when monsplasty is done in combination with other more extensive procedures, like a tummy tuck. Once the sedation has worn off, you'll be monitored for a short while to make sure you don't have any complications, and then you'll be released. After surgery, you'll usually have some discomfort in your lower abdomen and mons pubis. You'll notice mild bruising and swelling soon after surgery that'll typically last 2 to 3 weeks. You'll notice the results of your monsplasty immediately after surgery. By 6 weeks, you'll see the final results. The changes are permanent, but excess fat deposition can reoccur if you gain weight. Now that clothing styles are more revealing, women are becoming more conscious of how their pubic area, or mons, appears through the clothing. This is causing many women to seek treatment to reduce its size. Whether from a congenital cause or due to excessive weight gain, the pubic area can become fatty and make some women self-conscious and uncomfortable when wearing fitted clothing. Another cause could be from abdominoplasty or liposuction of the abdomen. Once the abdominal area is flatter, the pubic area simply sticks out more, causing a protruding mons. Fortunately, it can be treated via liposuction to improve its shape and size. Liposuction of the mons pubis is a relatively straightforward procedure that can produce some dramatic results.